Hello, it's good to see you. Thank you so much for coming in today.
I'm happy to be back.
Good, good. I know it's been a little while. So just a reminder, my name's Madison and I'm a physician assistant student. Can I just have your full name and date of birth?
Sure, Mary Catherine Whiteside, and my birthday's 10/3/90.
Okay. Good to see you again, Mary. So you're here for a follow-up, but it's been a little while, right?
It has been a little bit.
Yeah. So what I wanted to talk to you about was some lifestyle factors, specifically with smoking. Is that something you're comfortable with today?
Yeah, I'm okay with that.
Yeah. Okay. So first, I just want to start out with asking, are you still smoking? And if so, how much?
I am still smoking.
Okay.
I guess I can't even remember honestly the last time I was in, but I remember a little bit after we had talked about it, I tried to quit on my own and I really just had, it was hard to stick with.
Yeah.
So I've definitely decreased my amount, but I'm still probably smoking like I would say 5 or 6 cigarettes a day.
Okay. Okay. Well, that's a great improvement since I last saw you. And just to make sure I have everything right, do you remember how old you were when you did start smoking?
Um, I think I was about 17 or 18.
Okay. Okay. And recently, have you noticed any symptoms that you think might be related to your smoking?
Um, Nothing really out of the ordinary. Every now and then I have a bit of a cough, but
Okay.
it hasn't really become that bothersome. It
Okay.
actually has it got worse for a little bit and then it got a little bit better when I cut down on the amount of cigarettes.
Yeah. All right, great, great. We can talk a little bit more about some of those symptoms later. So I'm so proud of you for trying to quit and for reducing the amount. And I understand that there's a lot of different reasons to smoke. It's relaxing and it's really hard to quit, but quitting is so, so important to your health. So I'm so glad you're here today. And I'm really excited that we're going to be able to talk about this. Um, I just want to first start out by saying, do you know any of I know you already talked about a little bit of a cough. Do you know any other symptoms that can come from smoking that are bad for your health?
Not really. I just really know about the cough.
Yeah, so tobacco use in general, but especially smoking, actually increases your risk for just overall death. And then, like, symptoms like coughing, which can lead to COPD, which is like a chronic lung condition, and then numerous different kinds of cancers, the most being lung cancer, which I'm sure you might have heard about. So there's a lot of different reasons why I want you to quit, and I think it would be really good for you. Yeah. So I know you've already thought about quitting, and that was good that you've reduced it. Have you ever tried quitting besides that last about a year ago, the last time you were here? Have you tried in the past?
Nope, that was really the first time.
Okay. And so last year when you tried to quit, what exactly did you do to try to stop smoking?
I just tried to, as they call it, cold turkey it. I
Yeah.
just tried to put it down. And I probably lasted about a month or two, and then work got a little stressful. And it just became. I was able to keep the number of cigarettes down, but I just picked the habit right back up.
Yeah, that's totally understandable. And I mean, going cold turkey is really hard. So even to get a month, like that's really impressive and it shows that you definitely have it in you, okay? So I know that we're here and I know you don't want to smoke, but do you think you're actually ready to try quitting again?
I think I am. I just feel like I'm definitely happy to try again. I just think I it's hard to ask for help, and I feel like I might just need a little, like, I don't know. I've had friends that have, I think it's like some kind of gum they've chewed or
Yep.
some kind of, I'm not even really sure. I just think I need a little bit extra help.
Yes, definitely. And nicotine is so addictive and it's so hard to quit. So I'm happy to discuss all different kinds of options that can help you. You don't need to just do a cold turkey. You're not on your own. I'm here with you. And we have tons of different things that we can try. Okay. So can you tell me a little bit about your expectations? Or like you mentioned gum. Is there anything that you kind of are looking for out of this next quitting journey we're going to try?
I really just don't want to pick it back up.
Yeah. Okay. So I'm just going to kind of run through a bunch of different options. I'm going to do a lot of talking for a little bit, and then I want you to just think about which of those sound good to you and maybe which ones you know you definitely want to try. Okay, so I know you talked about the gum and stuff like that, but before we even get to that, if you weren't interested in something like that, there's different kind of lifestyle factors you could set up. For some people, it works to set up rules, such as no smoking in the house. You know, if you live with family members or animals, that secondhand smoke is also really bad for them. So kind of just reducing the places you allow yourself to smoke can make it a little bit easier. There's also counseling. You can do individual counseling, which I could help refer you and set you up with, or group counseling. And there's also counseling you can just do like over the phone or call different numbers or something like that. Now, if you were interested in something like the gum or some kind of substance or even prescriptions that I can give you, we have a bunch of different options. So the gum is a really popular one. It's pretty easy. The gum contains nicotine, so you're still getting the nicotine, but you aren't getting the tobacco and all of the harmful stuff that's in the cigarette. So it's literally just gum. You chew it throughout the day. You can get some like jaw pain and mouth pain, but usually nothing too serious. And similarly to that, there's a patch you might have heard of. You just like stick the patch on your arm. It's the same thing. It's giving you nicotine. So it kind of helps you not need a cigarette quite as bad. And then there's also a lozenge. So instead of chewing gum, it's just something you can suck on. All of those you can buy from the store. So that's both good and bad. You can go buy it yourself. So, you know, you don't need to go through me at all. But then at the same time, it's not going to be covered through your health insurance. So that's where something prescription might be a little bit better, because if we can get that covered, then obviously the less money out of your pocket, the better. So then some of the options that I could prescribe you would be a nasal spray and also an inhaler. These aren't quite as common, but you know, if you were trying to avoid a pill, these are some prescription options we could talk about. They are pretty expensive, so whether or not your insurance would even want to cover them would be a whole nother conversation. But so then the prescription medications I can give you, there's mainly two, but there's really only one that I would want to recommend to you. So this is called Wellbutrin. And it's actually an antidepressant, but at a small dose, we can use it and it kind of mimics the effect of nicotine. So whereas like the gum and stuff actually has nicotine, this doesn't, but in your brain, it thinks it's nicotine. So this is like one pill you take daily. And this one I think is around $67 for 2 months supply. So even if your insurance wasn't willing to cover it, you know, it might not be as bad as some of the other options. So I know I just gave you so many different things, but are there any of those that sound good to you or that you definitely are interested in?
Well, I don't like shooting stuff up my nose. I've never been good at those nasal sprays. I don't really want to take a pill yet. And then I'm not a huge gum chewer, so I think the patch that you were talking about sounds like it might work for me.
Yeah, totally. That's awesome. And when it comes to these things, combination therapy is also possible, so doing more than one. So if you wanted, we could start out with something like a patch, and then if that's not helping you as much as you'd like it to, we could also add some other things in.
Okay, I like the idea of that.
So like I said, the patch is over the counter. So you could go to any of your local pharmacies. I know CVS has it, or Target, CVS, Sam's Club, Walgreens, anything like that. It will be in a section with all different kinds of nicotine replacements. So you could take a look at all of them, you know, and read them for yourself, but the patches will definitely be there. So with that, the instructions will definitely be on the box, but typically you just will put one patch on and leave it there for, I think, a few hours or even a few days at a time. But you really just want to make sure to read the instructions on that specific patch to make sure you're following it appropriately. And I know with the patches, since they are nicotine, you're going to want to make sure you stop smoking when you put that patch on, because if you have too much nicotine, it's not going to make you feel too good.
Okay.
How do you feel about all of this?
A little overwhelmed, but this is I've had thoughts about doing this in the past, so I'm kind of excited to get it moving, and I didn't want to have to start any like medications, but I think the patch is a good common ground for me, so I'm ready to take this next step.
Yeah. Well, just the fact that you came in today shows just how ready you are. I'm so proud of you for being here. I'm so excited for you to try the patch and to reduce the cigarettes, because it's going to impact your health immensely. Like, you can start seeing effects even within like 20 minutes. So if you're all good with that, I would like to see you in 1 month. So if you could pretty please schedule that even before you leave the office today, and we can go from there. And if that's not working for you, like I said, at our 1 month follow-up, we can talk about some other things.
Okay, I can do that.
Sound good?
Sounds good. Thank you.
All right, bye.
Bye.